Welcome to another episode of Surgeons' Lives. I'm your host, John Monson. My guest today is someone known to me for 30 years or so, and we have grown up in our faculty careers together, although many thousand miles apart at the beginning. Dr. Tracy Hull has been in the Cleveland Clinic her entire faculty career. She has become known the world over as an expert in complex reoperative surgery, inflammatory bowel disease surgery, pelvic floor problems, and anal fistula disease. She's become an important opinion leader and leader in general in the field of colorectal surgery. Culminating perhaps as president of the ASCRS just a couple of years ago. She's been a tireless advocate for women in surgery and is now chair of the accreditation committee of the National Accreditation Program for Rectal Cancer. But there's much more to her life, and I'm hopeful that in our conversations today, she'll tell us a little bit more about what I call stuff that matters. So without further ado, let's go and commence the conversation with Tracy. I'm John Monson, and this is Surgeons' Lives. Welcome, Tracy, to Surgeons' Lives. Thank you for joining today. I appreciate you taking the time out of what seems to be an ongoing and relentless busy schedule of yours.
It is busy. I am trying to slow down. I have to say, kind of in the last several weeks, I've the rest of my office team has made a very concerted effort to slow me down some. So I'm trying to slow down.
Are they winning?
Yeah. It's still busy, but it is December was really crazy busy, so it's not at least crazy busy.
So I don't know if you've had an opportunity to watch any of these or listen to any of these, but normally what I do, and I will ask you to do, is I ask the person to start with just a brief summary of life, starting with the words, I was born in.
I was born when my dad was in veterinary school. It's important because I was born when he was in veterinary school.
Right.
And then we moved back to my parents' hometown, and my dad started a practice.
And where, I'm sorry, where was that? Where he was?
Ohio. I was born when he was in veterinary school at Ohio State University. And then they moved back to Fremont, Ohio, which is in northwestern Ohio, which is where both of them were born and went to high school and where they met. And my dad, my grandpa helped buy a house with a good sized garage for the time. It was 1960. And my dad practiced veterinary medicine out of our garage and did surgery on the kitchen table till about 1964 when he built a proper animal hospital when we could afford one. So at night, it was very common to have him be operating on small animals on our kitchen table at one end and us eating supper, my sister, myself, and my mother at the other end. Usually my mother was helping him.
Okay. It conjures up all sorts of visions, all of which would be illegal, of course, nowadays on about 7 different levels. But
exactly. But 1960 to 64, I mean, there were not as many regulations. It really gave me an idea that animals are pretty hardy because, we didn't have masks on. He had sterile gloves, but he didn't wear a sterile gown then. He just gave IV sedation. He didn't start to really intubate animals when he operated on them till about the late 60s, early 70s. So it's just IV medication. And he gave the medication and did the surgery. And my mom recovered them. I remember that we had a heater in front of our stove, and they would lay in a box in the heater while she recovered them until they were warmed up and awake enough to go back out to the kennels that was in the garage.
And in those days, being a vet, like a Moonlight Graham type vet, the
Oh
town,
yeah.
was that what's the way to put it? Were you top of the social strata, or in other words, did you make a good living doing that, or was it hand to mouth, or somewhere in between, or?
In the beginning, it was pretty hand to mouth. That was why we didn't really build a proper
Yeah,
veterinary clinic for several years because, he had
sure.
debt from college. And my mom worked for him, and we all were in the office. Well, once we built the office, we were in there constantly because everybody had to help. There was, before we went to school, everybody had to help. So it was on about 15 acres of land, and we had some cattle. And in those days, it was not uncommon for people to have beef cattle, and we raised cattle and butchered, had cattle butchered and ate a lot of beef. But as he went along, he was very successful and had good results. He was a generalist. He treated, in those days, there were a lot of cattle with tuberculosis and other diseases. And we did a lot of, I would go with him on farm calls. We did a lot of autopsies, particularly on cattle when they died. And he would make an incision, and then he would tell me to sew them up. And I got a lot of practice sewing with cat guts, because that's what he
Yeah.
would have us sew them up with. And I was pretty good with instruments, even I have to say, before I went to kindergarten, because I did a lot of sewing as he was talking to the farmers. So I had a lot of experience, and I knew that ingrained in me, that and the experience of watching him do a lot of surgery, that I wanted to be a surgeon. I just didn't know what kind. He also did surgery on, he had a very big racehorse practice.
Ah,
We spent summers sometimes in up by Cleveland at Northfield at the racetrack, because he did a lot of racetrack work. So he operated on a lot of racehorses. That was before specialization. Now you would send them to a equine surgical specialist for
yeah,
that,
of
a
course.
lot of
Yeah.
those kinds of things. So he had a very diverse practice with, I mean, we took care of skunks, we took care of raccoons. I mean, people had those for pets. We boarded them. Skunks make very good pets, I have to say.
They
Uh,
make very good pets.
yeah, yeah. So so in those days they descented them, and then people would
Ah,
have these pet skunks that they would have in their houses, and then we would take care of them, their whole lives, give them immunizations, and when people went on vacation, take care of them. I remember one was named Petunia, and we took care of her for like 10 or 11 years when for health care, and for when her family would go on vacation, we would board her in our boarding kennel. So he took care of a few turtles.
he was a
there was,
real generalist. Yeah.
yeah, yeah, but most vets were real generous in
Yeah,
those
sure,
days.
sure. Yeah, and of course nowadays the top of the tree is, like the equine, the racehorse
Yeah.
stuff,
Oh yeah, the
Um,
racehorse, the thoroughbred racehorse vets are really, and some of the other saddle type horses like quarter horse equine
yeah.
vets are very, very much, they're the ones that are at the top of the veterinary ladder, I suppose.
So your path was not totally set for you, but you certainly got a glimpse of what you might end up doing very early in life.
And our clinic was almost connected to our house. So
Yeah,
people would bring their animals like at all hours and on all holidays.
sure.
We used to joke that at Thanksgiving we would take bets how long somebody would bring some animal that was hit by a car. My dad did his own x-rays, so they would bring it in. My mom would get the turkey on the table because like our whole extended family would be there, and we would be out x-raying a dog or doing surgery, setting a leg, while everybody else was eating. And that went on for a lot before. Now they have ERs for those things, but
Yeah.
before that, you just showed up. Well, at our house, they just showed up at our house
Yeah.
because people knew that we were almost always at home, and that my dad, he was a softie. He
Hmm.
wouldn't turn anything away.
Are you a fan of All Creatures Great and Small? You know, the TV series?
I know the TV series. I don't. I've watched it a couple times, but I'm not. And I thought it was very good, but I'm not, an aficionado of it by any means. I lived it, so I don't need to
Yeah,
watch.
exactly. So nowadays, on I don't know, it's one of the UK channels. There's a channel. It's kind of a it's docu series of a guy called, I think he's called a super vet. And he's become really very famous. He's actually an Irish guy who works in England. And the forms of surgical intervention they do, he's a small animal vet, as in
Uh-huh.
dogs and stuff, are just extraordinary. I mean, he has his own CT scanners and stuff like that in his
Oh yeah.
practice, and it's a big deal,
Oh yeah. Oh
Um,
yeah. So, a lot of them have their own scanners, their own ultrasounds.
yeah,
The big clinics have MRIs, like for
yeah,
horses.
yeah,
But some of the small animal places that they'll have those things. It's pretty amazing. X-ray machines, veterinarians have had, just plain x-ray machines for, since the mid 60s at least. So that's
yeah.
not something new. But the more advanced things, absolutely, they do endoscopy. A lot of them do upper scopes, and they scope to look for colitis in animals. So,
So, the transition from there to college, medical school, etc., was not very challenging for you.
well, I don't think that I think that everybody goes through the part where, you're pretty darn, you feel pretty darn smart in college and you're at the top of the heap, and you go to medical school and you're lucky if you're average because you've got these brilliantly gifted people around you. So the book learning, while I had some experience in it and I could draw blood and give shots and those kinds of things, the book learning was still, I would have to say, pretty challenging. I I have to, I'm not like, my son is very, very smart. Like got a photographic memory, takes after my husband. However, I am a plodder and I have to like really study, and I'm not very good on standardized tests. So I would have to say that medical school was quite challenging in that respect because um, obviously you want to pass.
Yeah, that's for sure. And there's always people in your year that, as you say, you end up being average. I mean,
Yeah.
in my medical school year, there was a guy who's now a nephrologist in Buffalo, actually, but he'd come first in Ireland in the high school exit exams, the college
Yeah.
graduating exams. And he was by no manner of means nerdy or anything like that. He was like an ordinary guy who just, and he would be out doing all the college things, drinking and carousing, etc.
Yeah.
He just cruised up the next day and come first. And he came first. And there were one or two people, in the year that they found that really challenging because they wanted to win,
Yeah.
and there was no point, because
There's no point. I just wanted to pass. That was, I wanted to get the stuff I needed to get. I had to take a different view of things. So, I went to Ohio State to medical school, and I had to rearrange my thought process to say, okay, quit stressing out on everything. They have used this process to make good doctors. Just let them do the process on you. And, average here is okay. And I think once I had a lot of anxiety at first about it, and then once I got that kind of through my head, I did much better. And not, I was never like at the top of my class, never, but I certainly enjoyed things. And I always liked the clinic aspect of things. The book learning was just always really hard. I studied a lot. I mean, I have friends just like you described it, studied not nearly as much. And I would be like, how do they do that? I had to study a lot.
So, but you were not struggling with what you were going to do. I mean, you
I knew.
you knew what you were going to do.
Oh yeah. I said
Um,
from day one I was going to go into surgery, and they so I did my surgical third year clerkship relatively early, and I was so a lot of people were intimidated by some of the male attendings. I wanted to be on their service. I they didn't, I had put up with my dad, who could be very intimidating. So, when they would yell and carry on, I was just like, yeah, I've seen this before. And it was, I really learned a lot. And I had really good instructors and really, really good residents that really let me be involved as a third year medical student. It was, it just cemented it more that that was what I wanted to do.
and you were in upstate for residency
Right.
in
I went to
Syracuse.
Syracuse, New York for my surgery residency, correct?
Yeah. And the plan was always to go back to Ohio.
The plan was to be a plastic surgeon. I think my sister
Uh-huh.
has deformities. She's mentally challenged and has deformities. And I think growing up, she's my only sibling. And I think growing up, that made me very interested in plastic surgery. I did a lot of extra rotations. So in Syracuse, the plastic surgeons were the most miserable lot of people I have ever met. They were really grouchy. And residency was hard. It was before Libby Zion's
Yeah.
trial, and we were on a lot of every other night. You'd go home and go to sleep and get up and come back and be on call the next day, a lot of that. And the plastic surgeons weren't doing that, and they were really grouchy. The colorectal surgeons were always very happy and very willing. A lot of people were willing to teach. Don't get me wrong. I had a great learning experience. But the colorectal surgeons were very, very happy. And when I decided I wasn't going to do plastic surgery, thought, well, I would just do general surgery and go back to my hometown. And my good friend in residency, Chris Murse, said, well, I'm going to do colorectal, and that might be something you're interested in. So actually, I did not apply and think about it till it opened in June, and I didn't even think about it till like July or August. So I was kind of late to getting involved in doing a fellowship.
And you landed in Cleveland Clinic. For
All
your,
by accident, but yep,
well, that's what I
yep,
was going to say. I mean, it was turned out to be a good accident, but
yep. It was a phenomenal. I was there's a lot of things that have happened in my professional career with a lot of luck. And that was one of them. And it turned out to be really, extraordinary opportunity for me. And, I thrived. I really thrived during my fellowship year.
where was when you did the applications, where did you think was going to be your first choice?
Minnesota.
Minnesota. Yeah.
And I love Dr. Goldberg, but I had gotten married in 1986 and then left and went to Syracuse. And my husband worked for Ohio State in their chemistry department. He ran their NMR machines. And so we had this apart marriage,
Yeah.
which was probably good for the marriage because I got my electricity turned off 3 times. He had to come up and get it turned back on because you have to realize, that I couldn't pay my bills. You didn't have all the things you have today where, I didn't even have direct deposit. So I'd have all these checks sitting there and I couldn't get them into the bank because I couldn't get to the bank when the bank was open. And so, yeah, I got the electricity turned off a couple times. And so my husband would come up and he would never see me awake. And that wasn't a very good situation,
Yeah.
but he would make sure my bills got paid. So I was, really happy about that. And I really did want to go to Minnesota. Two of the staff at the faculty at Syracuse, they were from Minnesota. But my husband said, I don't know if our marriage can survive you going to Minnesota. So I looked very strongly at Cleveland and at Erie, Pennsylvania, and at Ohio State.
So do you remember who interviewed you in Cleveland?
Oh, I remember the interview very well. It was very daunting. So, yeah, it was, I can tell you exactly. It was Fazio, Oakley, Lavery, Milsom, and Church, and they sat on one side of a table, and I sat on the other side, and they
Yeah.
asked questions. And I'd been there, it was like 3 or 4 in the afternoon. I'd been there all day. So you have to realize, so I went to, I had become good friends with somebody that was a cardiothoracic surgeon, Bruce Levitt, who went back to Vermont. So I went to visit him in Vermont at one of my weekends off, my husband and I. And his next door neighbor came over. I think he really didn't want to have to babysit with his kids because his wife was out. And he goes, "Oh, we're going to introduce you to our next door neighbor because he's a colorectal surgeon." It happened to be Neil Hyman. And I only think he came over because Ann Levitt was cooking and watching the kids. But he talked me into, I hadn't actually applied at the Cleveland Clinic then, and he talked me into applying at the Cleveland Clinic and was really very enthusiastic about it. So on the way back, we stopped at a payphone. There's no cell phones then. And I called the Cleveland Clinic and they said, "Oh, I can remember," they said, "Oh, you're not, your CV isn't, your application's not strong enough for the Cleveland Clinic. We don't think you're our material." I said, "Okay, thank you." So I get back and you weren't supposed to get called out of the OR. So I get back on a Wednesday, they call me and said, "We just had a cancellation on Friday. Can you come for an interview on Friday?" And I said, "Oh, yeah." And I had just been on call on Tuesday, so I had to switch and take call Tuesday and Wednesday in a row. Could never do that now. And then Thursday night drove to Cleveland, and my husband came up from Columbus and met me. And then I had my interview. The interview, Dr. Lavery, I'll never forget, looked at me with, this poker face and says, "Why should we take you? You're nothing special." And I've teased him about this since. And I'm like, oh my God, this is such a disaster. And as luck would have it, one of the faculty
What was
from,
your answer?
"I work hard and I will make this place proud." He goes, "Everybody says that." So anyhow, I had supper that night with my husband before I drove back on Saturday, and I said, "Oh, this was terrible, and they'll never take me." But what happened actually was a surgeon named Dr. Chung, who had been in Syracuse, and I had been his intern. So, this is several years, and then he had come to the Cleveland Clinic. He went to Dr. Fazio without me asking and said, "She is really good. You should take her." He only saw me as an intern. He did
Yeah,
bariatric surgery.
yeah.
And that was how I got ranked, but I was ranked 15th. They made sure I knew that when I got here the first day. So I out of their 3 choices, I was not very high, but there were a lot of people that must have turned them down. So anyway, it was a lot of circumstance, but it was great.
And decades later, 30 years later, you're still there.
I know. I know.
Uh,
Isn't that amazing? Haven't changed jobs. That's true.
um, and so throughout that time frame, I mean, I'm guessing known or consciously or subconsciously, your dad must have been something of a significant mentor to you. I mean, just because you were working closely, whether you in those days, of course, people didn't use the term mentor.
Oh,
But throughout your career, did you was mentorship something that you thought about, or just availed of as it came up, or how did that work for you?
I never thought about it.
Yeah.
Never.
Mm.
I was so lucky. People kind of looked out for me and took me under their, their auspices. But, I never actively can say that I sought out mentorship, but I had wonderful mentors, so I was very lucky. My dad he was influential, but my uncle, who was an internal medicine doctor and really, really good, and ended up going back to our hometown because my grandpa had leukemia, and he actually kept him alive for a long time because he was one of those doctors that, he would just look at every lab and just really, really was very, very detail oriented. And I volunteered at the hospital when I was in high school, and that really cemented that I wanted to be. I couldn't decide veterinary medicine versus human medicine, and I didn't want to be an internal medicine doctor, but I wanted to be a doctor like him. He was very well respected. He was extremely, like I said, detail oriented. He also like threw charts and yelled at people. Things I told him recently, you'd get fired if you acted like that today. But I mean, in those days,
Yeah.
that was how people, I guess, made a point. I don't know, but I volunteered. It was funny because he would be in a terrible mood, and he'd want a chart, and they would give me they'd give me the chart and make me go take it to him. And I would say, you can, stomp your feet and act bad. It doesn't bother me. So I had a lot of that experience of people that could have behaved better that, yeah, right. Okay.
So, I can ask you this at any time during the conversation, but I might as well ask you now. Uh, you know, the world has indeed changed a lot since then. Not just in terms of what might be considered acceptable behavior, but also in terms of, people being advocates for different groups, if you like. Would you, outside of, standing up for yourself, which you obviously did without too much difficulty, would you consider yourself an advocate for women in surgery, or I mean, what's your observation on the world now in 2024 versus 30 years ago when you started on faculty?
Well, I think that certainly there's a lot more opportunity for women. Um, I get a little concerned because I worry sometimes women can use it, I think, as a crutch, like, you're doing that because I'm a woman. They don't do that so much to me because I'm a woman too, right? But there are a lot of things that I get concerned about. I think that maybe the pendulum now is swinging that, we're discriminating against white males sometimes, right? So we have to really be thinking about when we're looking at candidates, to me, that we're being, thinking about it with the right lens. I've advocated for women, but I've advocated for a lot of men too. I mean, I think that sometimes you need people to advocate for you because of circumstances, not because of your gender. Um, and sometimes you just need somebody to stand up for you that's got more marbles in their jar than you do. So I guess I do advocate for women, but there's a lot of men who come to me with their concerns or problems, and I advocate for them too. I think that in surgery, somebody just asked me this today, and I think you have to still, I don't care if you're male or female, you have to have a very thick skin. You can't take things personally, especially in the OR in the heat of things going wrong. You cannot take things personally. You got to step up, have thick skin, and do what you can to help with the situation. I think that keeping your head down, remembering that we're all doing this, the patient should be our primary focus. If you do those things, you really can't that's what you have to do, I think, to really be successful. And you shouldn't be looking for a crutch like, oh, well, I didn't get this because I was a woman, or they did this. I mean, I worry because sometimes I worry that there are some people that feel that way, gender wise. And I hope we're just looking at people as the best candidate.
Do you, I, for many years in the States, people call me up who are, Irish or English and say, and they will tell me their story of wanting to move or being in the States and all of that sort of stuff. Um, um, do women go to you now more than they did, on the basis that, 25 years ago, it wasn't really a conversation. I mean, the challenges were there, of course, and probably worse, for women. But, do you attract people to come for guidance and advice on gender issues or just on surgical issues, career progression in surgery in general?
I seem to attract people on all levels.
Yeah.
I attract them on family advice, career advice, what to do with patients. That in the last several years, I think since COVID has kind of receded from the, main focus of everything that we were thinking about, I have decided that I have given a lot of advice, and it is on many different levels, even cooking. I had somebody call me up and ask me how to cook a turkey because they wanted to cook a turkey. So I have to laugh. Many levels.
Are you a good cook?
I'm not a good baker, but I can cook. It's all about getting everything at the same time. I like to cook for like a lot of people, like 40 people or something like that, because
Oh,
then
wow.
you just, I don't like to bake, so desserts aren't my forte, but the getting everything so it is ready at the right time is, where
It's
I
just,
shine.
it's a
That
big skill set.
organizational thing.
It's a big skill set, for sure. Um, are you optimistic for, I did one of these with Neil Hyman, and he was saying that he was very concerned about the young surgeon starting out today, and he wants to be a resource for young surgeons starting out because of the challenges that they face that are different to the challenges that he and you and I faced. And they're uh, more challenging, if you like, in terms of the administrative issues, the governmental issues, the regulation issues, and the lack of recognition, if you like, and value, et cetera, et cetera. Where do you stand on all of that? Are you optimistic for a young surgeon nowadays, or do you look at the career that's ahead of them and say, yeah, that's not what I would want to do?
Oh, absolutely not. I think you have to be optimistic. Um, Whether you are or not, I think that one thing, surgeons will always have a job. If I was a radiologist or a pathologist, I think AI is going to really encroach on their jobs. Um, and I think that there's a lot of job security. I think it's a fascinating, the human body and what we do to it and it heals is just incredible. And I think if you go into it and you remember those things, that wonder of, oh my gosh, this person is letting me operate on them. And sometimes I have to not let that get in my head, because if you're doing a really big surgery, that sometimes that personal component of it is not good for your judgment in the OR. But I think that, I think there's still so much opportunity. And yes, but I go back to like the early 90s. And, I remember Dr. Fazio saying, oh my goodness, there's so many regulations and I can't believe it. And we have to sign all these charts and they're talking about we're going to have an electronic medical record. That'll be so horrible and terrible. He couldn't type, so it was terrible for him. And all these different things. And he looked at me and he said, "You don't even act like it bothers you." And I was just like thinking, it doesn't bother me. It's just the way things are. So I think part of it is in youth, you have a different perspective. And, young people have a different perspective than you and I had. And they've come with a different skill set than you and I had about coping with things. I still think we have to be mindful of how they internalize not errors, but complications. There's been a lot of talk about, how surgeons, some of them, just want to quit after they have a leak,
Yeah.
things like that. So I think they need a lot of support regarding that, a lot of support. But I am very hopeful. There's a lot of really, really fantastic young people, and I look at them and I can see so many aspects of me in them. And I think that, yes, we worry, are these people going to want to take care of us? Are they shift workers? To get through general surgery residency, I don't think you're going to be quite like that. And I think that things are okay. I never think of things as totally rosy. That's just not my nature, but I think they're okay and I'm hopeful. And yes, there are a lot of challenges. And I think that they just have to be just continually support each other. They have to support themselves, support their group, because they come with a whole different mindset and skill set than we had.
Well, they don't have to go to the bank to put the checks in, so they're okay with the electricity.
They just flip it in their phone. I'm sure if they got their electricity turned off, it would be rare. That's for sure.
That's right. So you may not be worried about poor Vic. By the way, I don't really type myself, so I do understand the issue. But there's not much you can do about it, and voice recognition software helps a little,
Oh yeah, a
et
little
cetera, et
bit.
cetera, especially as it gives you an enormous get out clause by saying this was dictated and therefore everything that's wrong is not my fault.
Yep, I get it.
But if that doesn't worry you, what does worry you today in 2024? What do you look at and you go, that's a problem?
Well, in medicine, in general, I heard we're going to have another COVID type thing. I think that's a real possibility. That, and I don't think we're remotely ready, like we weren't ready before. I worry about how people work together in teams. I think teams are so crucial to care of patients in this day and age. And I think we need to be really teaching a lot of leadership and team skills in medical school and residency. I think that's one of the biggest things that I think is different now than when I did my surgery residency. There was a lot more siloing. There's a lot of team approach now.
There is. It's interesting. A colleague of mine in England, points out that one of the difficulties with super specialization, which on one level is very good, but on another level is a problem because nobody's in charge. They're in charge of the left lung,
Yep.
but they're not in charge of working out what's the plan here,
Yep.
in terms of, and they come in, they do their thing, and they go. And the patients see this, I think. They recognize, who do they go to?
Right.
Um,
And that's a good point.
and
And
I think that's a problem. And yeah, as you say, teaching team skills. I'm not sure that people do teach team skills. They talk about it a lot, but not necessarily do the actual teaching. So, on the rare occasions that and hopefully increasing occasions where you switch the light out of the office and go home, I've seen you, my favorite video conference was walking along with the horse. during a very, very important discussion about rectal cancer. Um, what are this podcast is subtitle Stuff That Matters. What is the stuff that matters to you outside of the office?
My family matters. You know, my husband, my nurse said to me one day when I was talking about another surgeon, she said, "Well, you're lucky you picked a good partner. That's really important." And I think that's really important. You know, pick somebody that um, is going to understand what motivates you in your career. And I'm very lucky. Most people have not seen my husband because he kind of stays away from medicine, but I have a very good, supportive husband. My sister, who's mentally challenged, lives with us, and so he has some duties with her, but when I get home, I have all the duties. She's fairly self-sufficient, but it's like having a 5 or a 6-year-old, you know, every night.
Hmm.
What am I going to wear tomorrow? Things like that. I have to check to make sure she brushes her teeth, those kinds of things.
Yeah,
Um, so my family is very important. My son is still working on his PhD in paleontology, and he moved back home, which is fine with me because he helps with things at home. And hopefully, in a year from now, he'll be defending his thesis. COVID was very tough on his
sure.
education.
Of course, as a
Um,
paleontologist, that's when the big bucks will start rolling in.
no bucks. I told him, I said, "You're TAing. That's fine because you've got a job." I don't know.
Yeah,
But he is like this, you know, he's really a very, very brilliant kid, and I love spending time with him. And, you know, we do things occasionally. I have horses. My sister rides every weekend. We go to the horse trainers and ride. I keep the horse at the trainers because if I want to compete and show, somebody has to be able to have time to make sure they get their blankets on to keep their hair coats down, they're fed exactly the same time, they're exercised if I don't get home, those kinds of things.
sure.
So, and she rides her horse, and I ride my horse every weekend. It's about 2 hours away. And
The
I hope
horse is 2 hours away?
the trainer is 2 hours away.
Wow,
Yeah.
that's a long way away.
Yeah. Every weekend we go there and ride and come back.
I mean,
And
that's your whole day, basically. That's like,
well, you get up, you know, it's surgeon's hours. You get up early, you're there, you know, at dark 30, as the trainer says. He knows that I'm going to be there really early and, you know, then do your stuff and come home. And you can be, you know, home by 12 or 1 o'clock and have the rest of the day. So
and you
it's
have two horses?
actually we have five, but
Ah, I
uh,
see. This
yeah,
is, and
some of them are really old. Three of them are very old. And, you know, they're like, we have two at home, and we have a pony who's 40 some. So, you know, that's like a pet.
okay, wait a minute now. So hang on a second. Now there's horses at the trainers,
Yep.
and there's
Three
horses at,
horses at the trainers and two horses at well, one's a pony and one's a horse at our house.
okay, so you're a good buyer of horses. You're not a very
Oh,
good
I wouldn't say
seller,
that. Oh, no,
but
no,
but you're
no.
not a very good seller of horses.
That's a better thing. Yeah.
Yeah.
No, when I was in high school to make money, I would buy horses that had some kind of quirk, like their owner couldn't get along with them or couldn't ride them, and I would get a show record on them and sell them, and I made money and I did well then, but I've lost that skill. So I
Yeah.
am I picked out a really good horse 9 years ago, and I still have him after all this time. And I've won like 3 saddles with him and lots of prizes. And he still likes to be shown, and he's really fun to ride.
And what is your event? Is it show jumping or 3 day eventing or what?
Oh, heaven, no, no, that 3-day eventing, that's you have to have, yeah, that is way too scary for me. Um, so I do jump. This horse wouldn't jump though if his life depended on it because he just is scared of those things. He drives and he does dressage and does just different events where he has to do really precise movements while they're judging my equitation. So he is really very, very good at those things. He's really responsive. Everybody likes to ride him at the trainer's barn because he's very, very smart and responsive.
And
So,
how far do you go with for your events?
um, well, they're never very close, unfortunately. So, we usually go to Oklahoma and Texas for national events. Oklahoma twice a year, Texas once a year. And it's nothing to go for the weekend over by Chicago and show and come back. So um, I I try to stay within 8 hours for a weekend show, and then if you're going to go to a big competitive show, you're going to drive to where it is, and it usually is not close.
Yeah. I mean, that's quite a hobby. And of course, horses are not inexpensive.
My husband reminds me of that all the time. Yeah.
Yeah. Well, I have this problem
Oh,
here,
I know.
you know.
Yours is not inexpensive either.
Well, so this is a savings plan.
Oh,
Because because if unfortunately there is really only one ending to the horses.
right.
Whereas these, if you're lucky, and don't, that you can sell them, for hopefully more. Now there's in both hobbies, there's the money you spend during the enjoying of the
Yeah,
event,
yeah.
but that's, um, they're, it's really just a large amount of quite tried and trusted justifications for what you do.
Yeah, yeah, I get it. Well, mine is just a money pit. That's
Yeah,
all.
exactly. Exactly. So now, so let me ask you, everybody tells me, and maybe I shouldn't say this in public, but everybody tells me, oh, Tracy's retiring soon, etc. Although it doesn't sound as though anybody's told you.
Oh, no,
But
no, no, July.
so what was your thinking about there? I mean, how did you decide this is the day or this is the month or why or because some people, everybody has a different spin on it. What was yours?
My retirement plan, the way it is at the Cleveland Clinic, says retire at 65 or you'll be penalized.
Right.
So
So
I'm
that's it.
retiring on my 65th birthday. Yeah, that set it up.
And then what are you going to do?
I don't know. I have a lot of anxiety over that. Sometimes I wake up at night and think, oh my gosh, what am I going to do? I don't really know. I haven't had a lot of time to really think about it. Um, you know, I hope that I can, continue to show my horse. I want to continue to ride. I think that that's important just for my physical well-being. But otherwise, I have I'm a little nervous. I said to my husband, I could work at McDonald's, and he goes, "Oh, no, 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 no." He goes, "You would try to organize the manager and you would piss him off and they would fire you." So he thinks that that isn't a very good thought process. So I don't know what I'm going to do. I
Well,
haven't
you've
really.
got I mean, you have a very active hobby that so that as long as the money
Yeah,
holds out and the horses hold out, that's a good hobby for you. Will you do anything in the world of surgery? Not necessarily clinically, but I mean, I interviewed one of the very first people I interviewed in this was Rob Madoff,
oh
and
yeah.
Robbie just basically walked away, cold turkey. Moved, sold up, moved to Brooklyn with his kids, and goes to the museums and has 2 cups of coffee, and to quote him is mad for the opera, and not a moment's regret. I interviewed Jim Fleshman, who wants to work until he's 80. Um, and part of that he says his wife doesn't want him hanging around the house, so
Well,
that's
my husband's nervous. The honey-do list he's nervous about.
um so um do you think you'll walk away and surgery will not see you again other than dinners and receptions and things, or will you continue to do something? What do you think?
I don't know.
You don't
I
know.
have a lot of anxiety over that. I don't know. I think that um, I'm just going to wait and see what happens. I haven't committed to anything. They would love for me to stay on and do things here. And I just don't know. I just I can't commit to anything because I can't even slow down enough to think about it. And maybe I'm doing that on purpose. I don't know, but I do as the time gets. I've known this date for a long time because I've known what my retirement plan for the clinic has been, and I've known about it, and
Yeah.
I've told them I'm retiring, July of 2024. And as it's gotten closer, I am really a lot more anxious about it. I was surprised. I actually last night I woke up in the middle of the night and couldn't get back to sleep, thinking, "What in the heck are you going to do? Are you, And my brain's like moving a million miles an hour, and I'm like, "This is ridiculous. You got to get back to sleep." And I don't know. I am very anxious, and I think that I'll just have to wait and see. In my life, I've been very lucky. Things have kind of um, fallen in my lap, so to speak. And my whole professional career, I've had a lot of luck. And so I guess I'm hoping that continues. I would say that I
And
don't have any big plans.
surgeons are, surgeons are pretty uni-skilled. They're not very good at 11 different things. I mean, the ones that are exceptions in my
Yep,
experience.
yep.
And the ones that don't have anything other than surgery, again, just in my experience, don't do well in retirement. I mean, because they knowingly or unknowingly are defined by being that surgeon. And if they
And
don't
that's
have
really
it,
true. And that, when I, walk through the ORs, the same ORs I've walked to through decades, and I think, okay, how is it going to be when I'm not here on a very consistent basis? How am I going to feel about it? And I am, this month really has made me, for some reason, I've really thought about that. When I come in the morning, I'm almost always the first one in our office area, and it's very quiet and nobody's here. And I think, how am I going to be, when this isn't my domain anymore? I'm starting to clean my office out because I've been in this off. I have not, I am coming across things from the 1990s, and we just put a huge Iron Mountain trash can in my office because I was doing 15 minutes a day and filling up the Iron Mountain almost that we have that is for our office area. So, I'm thinking to myself, okay, when I get this cleaned out, how am I going to feel? What am I going to feel? So
I
I really don't know.
you may recall, um, about 20 years ago, I visited the Cleveland Clinic,
Yep.
and Dr. Fazio was there, and I remember being in his office, and I said to him, "Have you just moved into this office?" And he said, "No, why?" And I didn't pursue the conversation because I realized that he viewed his office in a slightly different prism to me. That's not to say my office is tidy for a moment, but you know, plenty of packing boxes is a bit of a giveaway.
Oh yeah, his is always like that. And there would be boxes everywhere. And his secretaries always knew where everything was. He would have that would be a little challenging for him, but his secretaries always knew where everything was. And he was the editor of DCR, and and it used to come in these bright orange bags, the mail with the manuscripts.
Yeah.
He would look like Santa Claus with his bag over his shoulder when he would go to, decide and who's gonna and he would bring one down and say, review this manuscript. And you'd be like, okay, whatever. You just like go right down the line here. But yeah, I know mine isn't quite as bad as that. But I still have like slides when you have carousels. I open one thing and I'm like, holy crap, these are carousels of slides.
Yeah, that's actually fairly close to being as bad as Fazio's, to be
No,
honest.
no, no. Mine was in a drawer though,
Oh,
not
okay.
in a box.
True. I also remember visiting the late great David Jagelman in Florida,
Florida, yeah.
and I sat in his office, and I there was something surreal about the office that I couldn't quite work out. He was sitting behind his desk, and all the papers on the table and the desk were sort of moving a little like this, just imperceptibly. And I couldn't, thought this is a little odd. And then I realized all the styrofoam tiles in the ceiling were going up and down like this. And I thought, what is this
Yeah.
about? And of course, the reason was because he had the air conditioning and the extractors on so much so that he could smoke.
Smoke. Okay. All right. That makes sense. They
So
probably had it turned up as high as possible, right?
he did.
Yeah.
And he said to me, I'll drive you to the airport, which is, like 30, 40 miles from
Oh, yeah.
where he was. And he had this white 944 Porsche. And I got into the car, and he got in and he shut the door. And out of the ashtray, it was like a snow globe. Came all of this ash that sort of generally sort of went over everyone. And he was quite a personality. So whenever whatever happens, how would you like to be remembered, and how do you think you will be remembered?
Pretty much like what most surgeons, I took good care of patients and was empathetic. Um, I think that was a good surgeon. That's how I want to be remembered.
And do you think that's how you will be remembered?
Yeah, yes, I do think so.
Yeah. So that's kind of a good thing. I mean, I've noticed, when I ask this question of people, that the younger people often seem to have, a much more focused, specific, a good surgeon, a good mentor, teacher, et cetera, et cetera. And, a few of the older people focus much more on a more global statement, a good person, um, good doctor, et cetera, et cetera. A lot of the noise that travels around your career, particularly in the world of surgical politics, doesn't really mean anything. It's what's it all for?
That's really true. And I think, the politics of where you work, the politics of your profession, I think they become, at least for me anyhow, maybe not for everybody, they become a lot less of a focus as I've gotten older because, I just do my own thing and that's the best I'm going to do. I think I'm a lot more satisfied with that aspect of me. I'm not always the nicest person, and sometimes niceness is a luxury, so I don't really, I don't really, I don't let a lot of the things get to me anymore. People, like, somebody will say something, negative about me, and I'll be like, yeah, okay, fine.
Exactly. Yeah. So let me ask you some deep and penetrating questions that you have to be careful answering, because your reputation could hinge on some of these answers.
Oh boy, okay.
Yeah. So, and they will cover. They're also a kind of a test as to how rounded a human being you are. So, are you a football or a baseball person?
American football. Because, I have to be careful. I'm not soccer, American football. I love American football. I cannot believe people, men, some women, but men do some of those antics and get up and do more. And I'm fascinated by like the defense and the offense and things like that. And some of the skills of those players. I'm very much into American football.
And are you a Browns fan?
Well, first I'm a Ohio State fan, diehard, have season tickets.
Ooh, dear.
Um,
Mm.
yeah, there you go. Michigan really,
Yeah,
gave it to us, I know. And I my family, we had scarlet and gray. We had rooms in our house. My father's cars were scarlet and gray. That's how dyed in the wool Ohio State fans we were. So yeah, Michigan beating us. Yeah, that was everybody knew. They certainly in the OR, the Michigan fans certainly made sure
yeah.
that they rubbed it in.
And what's
I,
your NFL team?
Browns are my NFL team.
Uh,
I have been diehard Browns. I grew up, not very far from here, a couple hours, and so it's always been the Browns.
yeah.
But yeah, I'm so used to saying, well, there's always next year.
Yeah, exactly. Well, my son, lives a few hours away from you,
Yeah,
where he opines in a very detailed and sophisticated way that I don't necessarily understand, but most people don't either, on matters NFL. Uh,
yeah.
as he's now in the midst of a feud with J.J. Watt over the use of
Oh,
it. Yeah.
yep. I know who J.J. Watt
So,
is.
what's your go-to sandwich?
Well, I would have to say that it would be grilled cheese, but I'm very careful and try to keep once you get older, you have to watch what you eat. And so I try to keep away from bread, but my go-to would be a grilled cheese sandwich.
And your favorite movie?
Mm. Home in Indiana. You don't probably never have heard of that. It was made in the 40s at our county fairgrounds where I grew up, obviously way before me. My father has a bit part in it. My grandfather, my paternal grandfather, was the secretary of the fair board then and helped organize it. And it's just a very interesting movie and has, our fairgrounds in it. And it's just a real the plot of it is okay, but the nostalgia of it for me is pretty high. So I'd have to say I love that movie. And other than that, I like movies, but I'm not like, I can't
And
say
who's
one.
the star of Home in Indiana?
I don't even know. The Afro-American guy, I don't even know.
Oh, okay. All right. Um, Mac or PC?
PC, my husband is like PC all the way. And, he like he's like my husband and son are our IT people at home, so they direct everything. So PC.
You have
And
no
that's
choice.
fine. Yeah. I don't
You're
that is really true. No choice.
yeah. Beatles or Stones?
Beatles.
And it follows everybody in the Beatles or Stones, and the Beatles thing has to split between Lennon and McCartney.
So, well, McCartney certainly outlasted Lennon. But I
Yes.
thought Lennon was probably not the better artist, but just the better proponent of different causes in the world. And I do like that. I thought sometimes Yoko Ono was a little bit much, but and some of the things they did were a little bit over the top, but certainly I I would probably take Lennon.
Well, thanks, Tracy. I appreciate it. I was trying to record a little intro for this earlier on, and I realized that we've known each other for the best part of 30 years. And in
Did
some
you
ways,
record about how we got to know each other? Did you say that?
I edited out all of the bits where you behaved badly.
No, you were behaving badly, as I recall. Okay,
I've edited all of those, but I mean,
got it.
we're at that stage in our life where, as you say, we just let that go now.
That's true. That's true. But you were the one reminiscing, so I just was going to bring that up just so everybody
Yeah.
had that
Yeah,
straight.
you didn't have to actually. You could have just let that go.
Got it.
So thank you so much. I appreciate it. These are done in advance, so it'll be a while before it comes out, but when it does, I'll let you know. And I really appreciate you taking the time, and I wish you well in the sorting out your anxiety and indecision over the next few months.
All right. Thank you. It was really lovely talking to you. Take care.
Bye bye.
Bye-bye.